So my talk today was about how we can increase exclusive breastfeeding rates. I talked about why it was important that mothers exclusively breastfeed their children to 6 months after the birth of the baby. I talked about, what generally is required to increase exclusive breastfeeding rates. I talked about how it needs to be community-based, how the programs need to be evidence-based. I talked about how they need to be at scale and they need to be tailored to the individual culture. I also talked about how we need hospital-level interventions, how we need community-based interventions, and how we need policy-based interventions. So the hospital-based interventions that I talked about was incorporating the Baby-Friendly Hospital Initiative, because we really do need that mother to start breastfeeding early after the birth of the baby and to be doing so exclusively, so that she is discharged home into the community exclusively breastfeeding. The next thing I talked about was community-based interventions, and I talked about the importance of mother-to-mother support and how that type of support that's long-term, that's based on experiential knowledge, that's available in evenings and on weekends, so there's an increased accessibility to that type of support. I talked about how that can increase breastfeeding exclusivity rates. I also talked about how we need to have mothers want to exclusively breastfeed, and how there is a need for a social marketing campaign to motivate mothers and society as a whole to want mothers to be exclusively breastfeeding to 6 months. And lastly, what I talked about was policy interventions of where we need to encourage mothers to continue to exclusively breastfeed when they return back to work. That includes educating mothers about what are the possibilities regarding exclusive breastfeeding and the workplace, but also including strategies regarding the employer and what the employer can do to make a bright, baby-friendly work environment.
What are some practical tips for how someone could take your presentation and implement it in their own hospital tomorrow?
Some of the practical tips related to my talk today would be including the Baby-Friendly Hospital Initiative into everyday care that healthcare professionals provide to new mothers. There's 7 to 10 steps that can be easily implemented into current practice. We also can be looking at the provision of the mother-to-mother support, so we can develop these telephone-based peer support programs. I've published several publications about how you can develop those in your community. Another practical tip would be around work-based policies. So developing, educational materials for mothers to inform them about what they can do to continue to exclusively breastfeed when they return back to work.
What is next for your research?
Okay. So the next steps related to my research, it's related to increasing a mother's confidence in her ability to breastfeed. So we're looking at breastfeeding self-efficacy and what we can do in the hospital to increase a mother's self-efficacy or her perceived confidence in her ability to breastfeed. We're also looking at how can we involve fathers in breastfeeding supportive interventions. Fathers want to be involved. How can we incorporate them effectively so that they can improve breastfeeding outcomes, and in particular exclusive breastfeeding? We're currently looking at co-parenting as a framework to guide these supportive interventions where we incorporate dads. And lastly, what we're doing is looking at how can we assess for maternal mood early in the postpartum period in a very systematic way, so that if a mother is experiencing lots of breastfeeding difficulties, that we can identify her as potentially experiencing postpartum depression and refer her for appropriate treatment.
Just based on your presentation today, is there 2 or 3 things that you would recommend an employer do to help a mother go back to work and continue breastfeeding?
So what an employer can do to provide a supportive environment for mothers when they return to work and they're breastfeeding is to provide a space for mothers to either breastfeed or to be able to pump and to store their pumped breast milk. We need to have the employer be open and receptive to various different types of work hours, and they may be extended or they may include breaks for the mother to be able to breastfeed and go to her infant in a local child care center, or breaks so that she can sit there and pump in a very relaxed format. We also need to have the employers make sure that they educate co-workers so that the mother has a supportive work environment, so that she's not perceived as getting some additional benefits that other employers aren't getting, but that they understand that this is really important for the mother to be able to have a supportive environment for her to continue to breastfeed.